Story of a new mother's postpartum struggle and tragic end. In a remote village nestled between mist-covered mountains, there lived a young woman named Rosa at 19. She had just given birth to her first child, a beautiful baby girl named Luninging. The birth was difficult, and Rosa, already weakened by months of malnutrition and exhaustion, struggled to recover. Her family, steeped in traditional beliefs, attributed her lingering fatigue and fever to Binat, a local term for postpartum complications believed to arise from inadequate rest or exposure to cold elements after childbirth. The descent into illness. Rose's body never fully healed. She developed persistent night sweats, debilitating headaches, and a fever that waxed and waned. Her mother-in-law, adhering to old customs, forbade her from bathing, eating certain foods, or even leaving their bamboo hut, fearing posma. Isolated and untreated, Rose's physical symptoms worsened. But it was her mind that began to unravel first. Sleep deprivation from caring for her newborn, coupled with untreated infections, triggered hallucinations. She would wake in the dead of night, screaming that shadowy figures were stealing her baby. Her husband, Juan, dismissed her cries as hysteria, blaming her weakness on the Binat. The village healers offered herbal brews and rituals, but Rose's fever raged on. The breaking point. Weeks passed, and Rose's delirium grew dire. She stopped recognizing her daughter, at times cradling a blanket instead of the infant. Other times, she'd sob uncontrollably, convinced Luninging was cursed. The villagers whispered that Rosa had been possessed by an aswang. Juan, ashamed and terrified, locked her in a dim room, hoping isolation would calm her soul. Unbeknownst to them, Rosa was suffering from septicemia, a life-threatening bloodstream infection likely stemming from an untreated uterine infection postpartum. The infection had spread to her brain, causing encephalitis. Her madness was not possession but a medical emergency. The tragic end. On a stormy night, Rosa's fever peaked. In a final burst of lucidity, she smashed the room's lone oil lamp, igniting the dried bamboo walls. The flames spread rapidly. Juan and the neighbors rushed to save the baby, but Rosa, consumed by flames and delirium, vanished into the inferno. By dawn, only ashes remained. The village mourned, attributing her death to Binat na Sumpa, a cursed postpartum collapse. The hidden truth. Years later, a visiting doctor passing through the village heard Rosa's story. He explained that her symptoms, fever, confusion, and hallucinations aligned with postpartum sepsis and postpartum psychosis, both treatable with modern medicine. Her death was not due to Binat or curses but a tragic consequence of ignorance, stigma, and lack of health care. Reflection. Rose's story mirrors countless untold tragedies in communities where maternal health is shrouded in myth. Binat, in medical terms, can signal grave conditions like infections, thyroid disorders, or mental health crises. Without proper care, these escalate into preventable tragedies. Rose's madness was not weakness, but a cry for help, a reminder that postpartum care saves lives. Her legacy lived on in Luninging, who grew up advocating for maternal health clinics in the mountains, ensuring no mother would suffer as Rosa did. The real curse, she learned, was silence. Note: this fictional story highlights the dangers of neglecting postpartum health and the importance of medical intervention. Conditions like sepsis, postpartum depression, or psychosis require urgent care, not stigma. Always consult healthcare professionals for maternal concerns. How to prevent postpartum complications, a comprehensive guide. Preventing Binat, a term often used in Filipino culture to describe postpartum relapse or complications, requires a combination of modern medical care, lifestyle adjustments, and cultural awareness. While Binat itself is not a medically defined condition, it refers to symptoms like prolonged weakness, fever, or mental health struggles after childbirth. Below is a detailed guide to minimizing risks and ensuring a safe postpartum recovery. 1. Prioritize prenatal and postpartum medical care. Regular checkups. Attend all prenatal visits to monitor for conditions like anemia, infections, or gestational diabetes, which can worsen postpartum recovery. After delivery, schedule a postpartum checkup within 6 weeks to assess physical and mental health. Professional support for symptoms. Report unusual symptoms immediately. Persistent fever, severe headaches, heavy bleeding, or foul-smelling discharge could signal infections or complications like sepsis. Mental health red flags. Extreme sadness, intrusive thoughts, hallucinations, or detachment from the baby may indicate postpartum depression or psychosis, which require urgent intervention. Vaccinations and medications. Ensure tetanus and flu shots are up to date to prevent infections. Take prescribed iron supplements if anemic, and antibiotics if infections arise. 2. Nutrition and hydration. Balanced diet. Focus on iron-rich foods to replenish blood loss. Include protein for tissue repair and calcium for bone health. Avoid excessive caffeine, processed foods, or restrictive diets, which can weaken immunity. Hydration. Drink 8 to 10 glasses of water daily to support milk production and flush toxins. Herbal teas may aid recovery, but consult a doctor first. 3. Rest and activity balance. Adequate rest. Sleep when the baby sleeps to combat exhaustion. Enlist family help for nighttime feedings. Avoid heavy lifting or strenuous chores for 6 to 8 weeks to prevent uterine prolapse or muscle strain. Gentle movement. Light walking improves circulation and reduces blood clot risks. Pelvic floor exercises aid recovery, but avoid high-impact workouts until cleared by a doctor. 4. Mental health support. Open communication. Share feelings with trusted family members or a therapist. Postpartum mood disorders are treatable, not a sign of weakness. Join support groups for new mothers to reduce isolation. Delegate responsibilities. Assign household tasks to others to focus on bonding with the baby and self-care. Limit visitors if they cause stress. 5. Avoid harmful traditional practices. While some customs are beneficial, others can be risky. Plasma avoidance. Restricting bathing or movement excessively can lead to hygiene issues or blood clots. Warm sponge baths are safe. Unproven herbal remedies. Some concoctions may interact with medications or worsen conditions. Always consult a doctor. 6. Hygiene and infection prevention. Wash hands before handling the baby or breastfeeding. Change sanitary pads every 4 to 6 hours and clean perineal wounds with warm water. Sterilize breastfeeding equipment to prevent mastitis. 7. Educate family and community. Debunk myths. Teach relatives that Binat symptoms often stem from untreated medical issues, not curse or weakness. Advocate for skilled birth attendants over traditional midwives in remote areas. Encourage male partners to participate in caregiving to reduce maternal stress. 8. Monitor long-term health. Chronic conditions like hypertension or thyroid disorders can mimic Binat. Schedule annual checkups. Breastfeeding mothers should monitor calcium and vitamin D intake to prevent deficiencies. When to seek emergency care. Go to a hospital immediately if you experience high fever with chills, chest pain or difficulty breathing, suicidal thoughts or hallucinations, severe abdominal pain or bleeding. Conclusion. Preventing Binat hinges on bridging cultural beliefs with evidence-based care. While traditions provide emotional comfort, prioritizing medical intervention, nutrition, rest, and mental health support is critical. Empower mothers with knowledge, access to health care, and a supportive environment to ensure postpartum recovery is safe and dignified. Remember, Binat is not inevitable, it's a call to action for better maternal care. Whether neglecting what is culturally termed Binat can be fatal or lead to madness depends entirely on the underlying medical condition causing the symptoms. Binat, in Filipino culture, refers to a range of postpartum complications, not a specific disease. The symptoms associated with Binat fever, weakness, postpartum hemorrhage, mental health changes can be indicators of serious, even life-threatening conditions if left untreated. Therefore, it's inaccurate to say Binat itself is fatal or causes madness. Rather, The untreated conditions it represents can have devastating consequences. Let's break down the potential dangers of neglecting symptoms commonly associated with Binat. 1. Postpartum hemorrhage (PPH). Severe bleeding after childbirth is a leading cause of maternal mortality globally. If PPH is not addressed promptly with medical intervention, it can lead to hypovolemic shock, organ failure, and death. Delaying treatment based on cultural beliefs about Binat can have fatal consequences. 2. Postpartum infections. Uterine infections, breast infections, or wound infections can develop after childbirth. If left untreated, these infections can spread to the bloodstream, causing organ damage, septic shock, and death. Symptoms like fever, chills, and pain, often attributed to Binat, are actually warning signs of serious infections. 3. Postpartum depression (PPD) and postpartum psychosis (PPP). While not directly fatal, untreated PPD and PPP can severely impact a mother's mental health and well-being. PPD involves persistent sadness, anxiety, and loss of interest in activities. PPP is a more severe condition characterized by hallucinations, delusions, and erratic behavior. In severe cases, untreated PPP can lead to self-harm, infanticide, or suicide. Dismissing these mental health conditions as simply Binat can have catastrophic consequences for the mother and her child. 4. Other underlying conditions. Symptoms associated with Binat can mask other underlying medical issues, such as thyroid disorders, anemia, or other infections. Without proper medical evaluation, these conditions may worsen, leading to long-term health problems or even death. 5. The dangers of delay. The most significant danger of neglecting symptoms attributed to Binat is the delay in seeking appropriate medical care. The longer a serious condition goes untreated, the higher the risk of complications and mortality. Cultural beliefs and practices that discourage or delay medical intervention can be incredibly harmful. In short, Binat is not a disease itself but a catch-all term for postpartum complications. Treating it as solely a cultural phenomenon and neglecting the potential underlying medical conditions is dangerous and can have fatal or severely debilitating consequences, including death and serious mental health issues. Prompt medical attention is crucial for any postpartum symptoms, regardless of cultural interpretations. No, Binat itself does not cause madness in anyone, regardless of race or ethnicity. The term Binat is a culturally specific term, primarily used in the Philippines, to describe a range of postpartum complications. It's crucial to understand that Binat is not a medical diagnosis but rather a collection of symptoms that can indicate various underlying medical conditions. These underlying conditions, if left untreated, could potentially lead to mental health issues in anyone, regardless of their background. For example, untreated postpartum infections can lead to sepsis, which can cause delirium and other cognitive impairments. Similarly, untreated postpartum depression or psychosis can manifest in various ways, impacting mental well-being. Therefore, it's not the Binat itself that causes madness, but rather the serious underlying medical conditions that the symptoms of Binat may represent. These conditions are not limited to any specific race or ethnicity. Anyone experiencing postpartum complications needs proper medical attention to prevent serious health consequences, including mental health issues.